I have the best job in the world right now, as far as I'm concerned, because I believe so much, because I see it every day in the power of helping people take charge of their own health.
If it wasn't for this program, I don't know where my life would be. I see where I'm at now, being able to do activities I haven't done in years. I am so grateful to lifestyle medicine because it has really saved my life.
When I practiced primary care, I felt like I tried to do a great job talking to my patients about their health habits. And yet, both my patients and myself were frustrated over and over again when nothing really had changed. And in fact, oftentimes things would get worse with their chronic conditions. I got a great opportunity at St. Luke's Health System, and when I walked in the door to interview for that position, I just knew that this is really where my life was going to go, because what I witnessed was team-based care, and that these patients were actually improving their quality of life and their function. I really got excited at the possibilities that this is really the way healthcare should go, and we should find a way to make that work for patients and for healthcare systems.
I got involved in lifestyle medicine about 8 years ago when we weren't even kind of thinking or using the terminology of lifestyle medicine. Having that multidisciplinary team really allows all of those specialists to focus in on their specific pillar. I'm not an expert in behavioral health. I'm not an expert in sleep or diet, and that's where we really rely on our dietitians, our social workers, our clinical psychologists to bring that expertise to the table so we're treating that whole person.
St. Luke's had the vision that they would be moving into more of a value-based care model. So when the opportunity presented itself with the Treasure Valley YMCA reaching out for a healthcare partner, St. Luke's raised their hand and came back to myself and my partners in our department and said, we'd really like you to design and build a clinic that offers health habit improvement programming.
What brought me initially to St. Luke's was my health had deteriorated a lot. I had diabetes, also cirrhosis of the liver. On top of that, I also had chronic fatigue, and it made a big difference coming to lifestyle medicine and being able to have not just one person, but an entire staff that was there to help me through, no matter what it was. At first, it was a little, intimidating for me because I didn't know what to expect.
At some point, it became obvious to her that she needed to jump way into the water.
With the plant-based diet, it allowed me to reduce my medications. It has a direct result on the chronic fatigue. And it took me a while to understand that. It took me a while to understand the stress that my body was under.
She started to address her sleep issues, and her energy started to improve. And all of a sudden, this sort of fed into this cycle of virtue that helped her become more confident, and she really has made remarkable improvements. In fact, she started to thrive.
I'll never forget Dr. Shaw's called me after I'd had blood work done, and she said, "Your results are normal." And I just started bawling because I was so excited and so happy and so grateful. If it wasn't for lifestyle medicine, that would have never happened.
It's hard. It's not easy. If it was easy, everyone would do it. But, sometimes those hard things are the right things to do. And that's going to be kind of the wave of the future, is that the more and more payers are going to be covering kind of these non-traditional lifestyle medicine services. And then hopefully in the future, we can drop that non-traditional, and these are just going to be traditional services that every single patient expects to have as part of their benefits.
When you can teach people how to take better care of themselves and overcome barriers to making sustainable health habit change, and they start reaping the benefits and start feeling better and start becoming more confident and building self-esteem, and then they're influencing their other family members and their neighbors, you are throwing a little rock in the pond here and having this incredible ripple effect on people's lives.